Back in 2006, I actually started talking about benefit reform. I think a lot of people remember that. It wasn't probably the best time in my life in dealing with inflatable rats and rallies and everything else that took place. But the purpose wasn't to attack anybody. It was recognizing a system in free-for-all that was collapsing. And unfortunately, 5 years later, we're much worse off. So everyone keeps saying, well, we're going to fix it, we're going to fix it. Well, we haven't yet. Fortunately, attitudes are changing. A lot of workers actually recognize that if they want health insurance, and they want the kind of health insurance that's available now, that they're going to have to pay for it. I hear it from rank and file workers, day in and day out. So I'm proposing some legislation that's pretty simple. People are going to pay more. But what it's going to do, it's going to save hundreds of millions of dollars for local mayors. It's going to give towns the ability to control property taxes, because if you remember when we did the property tax cap, we kept pensions and health care out of those caps for one reason. We hadn't done anything to fix the cost. But most importantly is this is fair to taxpayers. The details, as I said, workers are going to pay more. It's not really difficult to figure out. We're going to phase it in over a 7-year period at the end of collective bargaining agreements, because I think that's fair. Because you're asking someone to get this cost all at once, and for some people it would truly be a hardship, especially since we just put a 2% property tax cap in. So we want to be fair, but we actually want to make this plan work. Another key component of this plan is that we're going to create at least 5 health plans. Because as you're asking people to pay for health insurance and pay more for health insurance, you're going to have to give them some options on what they can afford also. Today's press conference was a discussion about legislation that I'm putting in on Thursday that's actually going to deal with health care reform. Back in 2006, I raised the issue of benefit reforms in the state because back then we were in serious trouble. 5 years later, we're in worse shape than we were then. We have to get serious with this reform, and this legislation gets right to the crux of the issue. People are going to have to pay more for health insurance, just like they do in the private sector. All government employees, from authorities to school boards, all employees that draw a government check are going to be part of this system. No one is going to be outside of it. I never once thought this was going to be an easy task. Last year proved how tough it is when we did the 1.5% for healthcare costs. So I expect this to be extremely challenging, but in the end I think we'll be able to come up with a bill that the governor, the speaker, and I can live with. We can't not do anything. We can't. We're at a crisis right now, and this whole state's financial situation is going to collapse. We just had a bond rating downgrade. We're going to continue to see those things, and this state is going to wind up a second-class state instead of the first-class state that it is today. The governor and I have had many disagreements, but the governor, the speaker, and I have had many successes. We did a property tax cap. We did insurance reform, unemployment insurance reform. We did interest arbitration reform. We've done a lot of good things to move the state forward, focusing on what was fair to taxpayers. Well, I'm willing to work with the governor and sit down with the governor. This is my plan. I know the governor put a plan together. As I said, the pieces that are completely unacceptable to me is asking people to pay 30% at one time right now, but I'm willing to work with him to come up with a compromise, because honestly, it's 5 years since I had that press conference in the State House. This situation has gotten gravely worse. Taxpayers can't afford this, and a lot of people have to understand, the taxpayers, a lot of those taxpayers don't have health insurance, and they're footing this bill. So it's not about the haves and have-nots, it's about being fair. This plan is fair to workers, to taxpayers, to everyone. and I look forward to, and hopefully the governor's going to be open to working together so we can come up with a solution.